who is exposed to
Hello.
a hepatitis B virus person. Hepatitis B virus person. Okay, pooled immunoglobulin, the unit is 100 IU per ml of anti-HEV given intramuscularly, inactivated with formaldehyde, adsorbed to aluminum hydroxide. So prophylactic, like it has a prophylactic uh, way also, prophylactic immunization. Okay, for travelers to area where hepatitis A is common. If you are not getting vaccinated with hepatitis B. Okay, so when active immunity is not possible, okay, the person can be, what to say, administered with pooled gamma globulin. And then percutaneous transmission. So screening for donated blood for, yeah, so the blood and blood products should be screened for hepatitis B antigen and anti-HCV antibodies. So when they are positive, we can avoid their transfusion and use of disposable needles and syringes. Sexual transmission, yeah, acute exposure. Okay, when there's an acute exposure, yeah, better they can go in for a passive immunization with HBIG. Okay, if there happen to be, what is a partners, sexual partners, then we can, what is a administer, okay, to the sexual partner, right? And then condoms can be used, and HB vaccine, okay, series they can be administered to the uninfected sexual partner. Okay, an HBV vaccine is a part of the prophylactic, what to say, regime. That's vaccination regime. Right. Now, so in a nutshell, how to prevent the hepatitis infection? Prevent the infection among the newborns. Yeah. All newborns should be vaccinated against hepatitis B at birth. So, immediately after birth, hepatitis B vaccine should be given, followed by 2 booster doses. Right. That's the first way of prevention of hepatitis. Second thing, there is less of reports, okay, saying that hepatitis infection is transmitted from mother to fetus. Okay, but after after delivery, after birth of the child, okay, transmission should be stopped from the mother to the child. So the mother should be routinely tested, or the pregnant women should be routinely tested for hepatitis B. Okay, because the pregnant women can contract hepatitis B, C infection anytime. Okay, so it can be tested for hepatitis B, HIV, and syphilis. And for hepatitis B, they can also get tested for HIV and syphilis, and can also receive treatment if needed. And then, yeah, you should not leave anyone behind. You should not think anyone as, what to say, unrisky person. No. So we always say, think any blood or blood products as contagious. Think that it is a HIV blood, or think that it is a hepatitis blood. Then only you know how to handle the blood. Okay, so consider all blood and blood products as contagious, infectious. Okay, right. Even if it is from your friend, right? That is the precaution we give to the children when they come to laboratories. Everyone should have the access to hepatitis prevention. Yes. Okay. Social justice, testing, and treatment services. Nobody should be left behind for testing and for treatment also, including people, okay, who inject drugs, okay, people in prisons, migrants, and other highly affected population. Social justice should be followed. And not only that, expand access to testing and treatment. Just like we did a extensive corona testing. Okay, we did an excessive corona treatment. Okay, if they're found to be infectious, okay, they should be treated. Timely testing and treatment of viral hepatitis can prevent liver cancer, because liver cancer only kills people. Liver cirrhosis kills people. Hepatocellular carcinoma kills people. Pulmonary hepatitis kills people. Okay, so they should not be taken into a condition of severe liver disease. So repeated or timely testing can prevent the liver disease. Okay, and not only that, maintain essential hepatitis service during COVID-19 also. Prevention and care services for hepatitis, such as infant immunization, harm reduction services, and conduct treatment of chronic hepatitis B carriers or patients, okay, or essential during the pandemic, that is during the corona pandemic. Okay, so I wish you all a safe World Hepatitis Day. Care for your life. Don't let hepatitis separate you from your dear and loved ones. Thank you. Any doubts? Any doubts?
Ma'am,
Ah,
thank you very much, ma'am. It was a very
okay.
informative and enlightening lecture, ma'am. I'm
Okay.
sure all will agree with me that you had delivered such a lecture that has thoroughly covered all the aspects of hepatitis. Thank you very much again, ma'am. Now is the time for questions, students.
Yeah, I want students to ask questions.
Yes, madam. So I request the audience to please ask the doubts if you have any.
I dealt with more about the prevention and treatment, not about the molecular biology of hepatitis B, C, and all. Actually, that becomes a microbiology class. Okay, so I've given only an overview as per the guidelines of Dr. Kadiresan sir. Okay, not much into the actual microbiology of hepatitis. I didn't deal with the actual microbiology of hepatitis. Okay, because on a World Hepatitis Day, they should know more about the infection mode, prevention, and prophylaxis. Okay, prevention or prophylaxis. Okay, students, please ask questions. I'll be more happy.
Excuse me, ma'am.
Yes. Ah,
Ma'am, I have a doubt, ma'am.